Labor and delivery of a baby typically consist of 4 main stages. Each stage is characterized by specific events and changes in the mother's body as she progresses toward giving birth. The first stage of labor consists of latent or early labor, active labor, and transition phase. During early labor, contractions begin, but they are usually mild and irregular, often lasting around 30 to 45 seconds with 5 to 30 minutes of rest in between. The cervix starts to efface or thin out and dilate or open up in preparation for the birth of the baby. Dilation is measured in centimeters, with 10 centimeters being full dilation, going from a thick, closed cervix to a thin, partially or fully effaced cervix. This can last for several hours or days for some women, characterized by physical and emotional changes. Some women experience a bloody show, which is a discharge of mucus mixed with blood from the cervix as it begins to dilate. Most women may also experience cramping, mild pelvic pressure, or a persistent dull backache due to the pressure from the baby's head engaging in the pelvis. Some women may also have their water break, which means the amniotic sac ruptures and the amniotic fluid pours out. Note that the amniotic sac can break at any stage of the labor, even at the last stage. Some children are even born with the amniotic sac intact. It's important to time contractions during early labor to determine if they are becoming more regular. This will also help determine when to go to the hospital or birthing center if that's your plan. It's generally recommended that women stay active during early labor. Walking, changing positions, and using relaxation techniques can help the progression of labor and ease discomfort. Staying hydrated and eating light, easily digestible snacks can provide energy and support during early labor. Having a support person, such as a partner or doula during early labor to provide emotional support and assistance is important. Active labor is the second phase of the labor process in stage 1, following latent or early labor. Contractions become more regular, frequent, and intense in active labor, typically lasting 45 to 60 seconds with 3 to 5 minutes between contractions. Contractions help push the baby's head down into the birth canal, opening the cervix more and more. Cervical dilation progresses more rapidly during this stage, reaching about 4 to 7 centimeters and typically progresses at a rate of about 1 to 1.5 centimeters per hour during active labor. Some women may experience their water breaking during active labor. The obstetrical provider can also perform an amniotomy, which is artificial rupture of the amniotic sac in active labor phase to speed up the labor process. Many women may opt for pain management options during active labor, such as epidurals, nitrous oxide, or other non-pharmacological pain management interventions, to help alleviate pain and discomfort. The baby's and the mother's vital signs are typically monitored regularly during active labor to ensure the well-being of both the mother and the baby. Active labor can vary in duration, depending on various factors, including the mother's overall health, the baby's position, and individual circumstances. It generally lasts from several hours to around 8 to 12 hours for first-time mothers and may be shorter for subsequent pregnancies. The transition phase of labor is the final phase of the first stage of labor. It is the most intense and challenging part of the labor for many women. The duration of this phase can vary from person to person but often lasts between 15 minutes to a few hours. The transition phase of labor is the final phase of the first stage of labor. It is the most intense and challenging part of the labor for many women. Contractions become very intense, lasting 60 to 90 seconds, and occurring 2 to 3 minutes apart. At this time the cervix is fully dilated. Once the cervix is fully dilated, 10 centimeters, the mother may begin to feel an urge to push. Fetal station is the position of the baby's head or other presenting part in relation to the mother's pelvis during labor. This describes the progress of the baby's descent through the birth canal or the pelvis. Fetal station is typically recorded in negative and positive numbers including 0. If the baby's head is still above the mother's pelvis and has not yet entered the birth canal, the station is described as negative, such as 5 cm, 4 cm, 3 cm, 2 cm, and 1 cm away from the mother's ischial spine. 0 station is when the baby's head is at the level of the mother's ischial spine. This is when they say the baby's head or presenting part has engaged. The baby's head has passed through the pelvic inlet but has not yet fully descended further into the birth canal. Positive station is when the baby's head has descended into the birth canal and is below the level of the ischial spine. It is scored as +1 cm, +2 cm, +3 cm, +4 cm, and +5 cm. The baby's head moves through the birth canal and eventually crowns or becomes visible at the vaginal opening. Pushing is done during contractions to help the baby move through the birth canal. To be successfully delivered into the world. The head elongates for ease of passage through the birth canal. The obstetrician or midwife can help by maneuvering the head of the baby to deliver the shoulders one after the other. This stage can last a few minutes to several hours, depending on various presenting factors. The baby's and the mother's vital signs are continuously monitored during this phase to ensure both are stable. It's important to follow the guidance of the obstetrician or midwife and the birthing team during this time to ensure a safe and healthy birth experience. The third stage of labor begins immediately after the baby is born and ends with the delivery of the placenta. Contractions continue, and the mother may be instructed to push or allow the placenta to be delivered passively. The placenta detaches from the uterine wall and is expelled through the vagina. Once the placenta is delivered, the uterus continues to contract to prevent excessive bleeding by closing off blood vessels at the site where the placenta attached. The fourth stage of labor, sometimes called the recovery stage or postpartum stage, begins immediately after the birth of the placenta. This is the point where the healthcare providers ensure that the placenta is intact and that there are no remaining fragments inside the uterus, as this could lead to complications. Both the mother and the baby are monitored closely, assessing vital signs, uterine tone, and vaginal bleeding to ensure that the baby's overall health is in a perfect state and the mother is stable and recovering well. If the mother had a vaginal tear or an episiotomy, healthcare providers may repair these tissues during the fourth stage. This fourth stage is an excellent time to initiate breastfeeding, as many babies are alert and eager to nurse shortly after birth. Breastfeeding at this stage facilitates skin-to-skin contact and bonding between the mother and baby. It's important to note that labor and delivery experiences can vary widely from one person to another. The duration and intensity of each stage may differ, and some may require medical interventions or cesarean sections if complications arise. Additionally, emotional support from birthing partner, healthcare providers, and a well-prepared birthing team can play a crucial role in ensuring a safe and positive childbirth experience. Thanks for watching.